Assalamualaikum. I am Taiba and you are watching your own channel Audiovisual Books with the editorial and opinion section. I am here. The editorial I'm going to add and want to read for you is Frontline Anxiety by Asma Humayun. It is 7th June 2020. Let's start. At the end of March, Pakistan's first hero, doctor, lost his life in the fight against COVID 19. He was 26 years old. Since then, nearly 2,000 medical professionals have been infected with COVID 19. 30 of them have died. Our media is quick to portray health professionals as heroes and martyrs, but the reality is that pandemic is an uneven contest, testing the limits of a fragile system, exhausting existing health facilities and consuming health workers. Even in normal circumstances, healthcare is a challenging profession known to adversely impact the mental health of staff and compromising their quality of life as well as work performance. And these are anything that normal circumstances since the pandemic began, healthcare workers' challenges have multiplied. At a personal level, healthcare workers are afraid of contracting the virus and exposing their families to risk, burdened by the abdiction of domestic responsibilities such as childcare and face the social stigma that comes with the working with COVID 19 patients. Healthcare workers' emotional needs must be addressed professionally. They might feel overwhelmed by the onslaught of patients, frustrated with the lack of hospital supplies, including PPEs, tired of having to make painful decisions about which patients to prioritize, exhausted from long shifts, distressed from daily conflicts at work, and distraught from having to deliver bad news to bereaved family members. These challenges are further compounded by highly tragic episodes involving doctors being arrested for demanding PPEs, having their salaries deducted for the coronavirus fund, or facing angry mobs intent on vandalizing hospitals and attacking healthcare workers. Healthcare workers are humans too, and they need to take care of themselves so that they can continue to provide vital services during this protracted public health crisis. They routinely face conflicts over their safety being compromised as they fulfill their professional obligations. Many feel helpless dealing with an illness that has as yet no treatment. Nearly all will, at the same point in this pandemic, grieve over the succumbing of their patients or colleagues to the virus. A review of 6 studies examining mental health issues faced by the healthcare workers due to COVID-19 confirmed significant level of distress and moderate to high levels of clinical conditions among respondents. Despite this undeniable evidence, mental health care remains stigmatized in Pakistan, and the repercussions of this for those on the front line are even more pronounced. Policymakers thus far have paid insufficient attention to the emotional needs of health workers fighting COVID 19. Health managers don't see psychosocial support as a necessity, and health workers experience shame and embarrassment in seeking help. Other countries are prioritizing psychosocial support for healthcare staff and dedicating specific resources on a war footing. The government of Pakistan has also launched a national campaign, We Care, which aims at providing adequate PPE and creating an overall psychosocial environment of care and support. This campaign has been verbally endorsed by provincial health ministers too, but it is important to translate this commitment into action. A report in JAMA identified top sources of anxiety for healthcare professionals working as frontline respondents and summarize their need as here me impartial mechanism to contract with the health workers while maintaining confidentiality and collect data and assess their needs. Protect me ensure personal protection. Implement workplace policies to prevent burnout like adequate rest and rotation. Supervise for difficult clinical decisions. Sport me, that is workplace counseling and services for stress management. Sport group backup support for taking time off work. Prepare me, that is self help training to deal with stress, offer training to deal with psychological challenges. Care for me, identify and treat those suffering from high level of stress and with pre-existing mental health care conditions. Implementing these strategies in Pakistan may seem far-fetched and idealistic, but similar cost-effective models already exist elsewhere and should be easy to replicate. Our provinces must prepare a comprehensive plan to support their healthcare staff on the front line. Each tertiary hospital in the country has a department of psychiatry, which in turn has at least a dozen mental health professionals. Each district hospital has at least one psychiatrist, and these professionals must be assigned specific duties to support health workers in hospitals. Health workers face both psychological and logistical barriers in seeking emotional help. Not least of which is the fact that they simply don't have the time to source sport. Unless psychosocial sport is immediate, effective, and efficient, they will continue to suffer. Thank you. Please like and subscribe to get all the latest videos and editorials and audiobooks in your notification or message box to be notified. Thank you.